Hello, thanks for joining us. I am so glad that you're here. I really want you to get the most out of this. If you signed up, you either have had a hysterectomy or are considering getting one. And I just want to find out more about how I can best answer your questions and really make sure this is tailored toward what you want to get out of it and what you want to learn. So if we have not met in the past or talked, if you could just type in the chat and let me know, and throughout, if you could ask questions. At the end, I will have some time to be able to answer some questions and also address some specific exercises and some things throughout this as well. So if you could let me know what you want to get out of this by typing in the chat, that would be super helpful. And I will go ahead and start. So thank you for joining me. This is the hysterectomy healing mini course, all about how to optimize your recovery and feel more confident in your body. It's something that is very important because I feel like it's so needed. There are a lot of women I've been seeing over the years as a pelvic floor physical therapist who have come to me after a hysterectomy, or maybe they had one years ago, and I start teaching some things about their body and how to restore their strength and get over some of the pain they're having. They're like, why didn't I know this stuff before? Well, that's exactly what I want to do, is fill some of those gaps. Your doctor's more concerned with infection and really like the big red flags, but they're not going to teach you about your muscle strength and scar tissue and those kind of things that can be really important to your healing. So that's where I am going to go into. My name is Dr. Dawn Andalone. I'm one of the owners of Level 4 PT and Wellness in Encinitas, and we do a lot of pelvic health and women's health physical therapy. So what are some words that you would use to describe the way you are feeling right now? If you've had a hysterectomy, it doesn't matter how long it's been or maybe how recent it's been, but I just want to share what some women do tell me when they come see me. But think about that. What words would you use right now? Are you having any fear over your recovery, or maybe what you've gone through before the hysterectomy, or where you may be in throughout your recovery or after, what you'll be able to do? Any nervousness, scared, feeling like unsure, not confident about your body, maybe a little frustrated. If you're somebody that has gone through that first 6 to 8 weeks and you're still dealing with some symptoms, are you feeling frustrated about that, or what you are not sure? What's normal, what's not normal? Is anything painful? That is definitely down the route what I'm going to talk about too. And we want to eliminate all of these words and just make you feel more confident. So if you stay to the end today, I do have a special giveaway and you don't want to miss this. Plus, I'm going to give you 4 top special healing tips that you won't get from your doctor. And you might not even get from certain physical therapists you see either, if that's the route you're going to take. So I just want to make sure we get all bases covered and you feel confident and strong and feel like you can tackle this. So a couple of these tips we will actually do on this mini course. So I want you to be able to stay and learn something too. About me, my name is Dr. Dawn. I told you before, I'm a pelvic floor specialist. I got into this because of some of my own issues that I was dealing with, and just wanted to be able to take my orthopedic background as a physical therapist and take it to the next level by learning more about pelvic health, pelvic floor, because it's not something a general PT treats. You really have to go through continuing education and training, a specialty in the pelvic floor, with bowel and bladder issues, reproductive issues, post-surgery, postpartum, postmenopausal. There's lots of things that we learn that's outside of a general PT. I have also written 2 books, soon to be 3. My 3rd book is all about aging and menopause, so stay tuned for that. And so I would just want to share, a client of ours gave me permission to share her story. She's actually 40, she's 49. So her main issue before was having her recovery was not what she expected. She's not sure what she should be doing to help her body heal. And she was like, why am I having this symptom, this symptom? So really able to guide her and teach her some things she didn't know. So I just wanted to share that because it happens every day here. I see somebody that they think that maybe they're the only ones dealing with it. And I promise we have heard it before. There's a lot of similar stories, but also just a lot of resources that you may not realize can help guide you. So what the heck is your pelvic floor? If you've had a hysterectomy, you know what your pelvic floor is most likely because you have undergone some trauma there, and also whether you had a partial hysterectomy, full hysterectomy, just talking you through what those pelvic floor muscles need to go through and restore, and whether you are postpartum and you had a hysterectomy, or it's been like more of a thing that a surgery that was recommended later on, maybe due to cancer or any other reasons why you would get a hysterectomy. It's going to be important across the board to really understand what your pelvic floor muscles do and how we can be able to restore them and support them. So this is a picture looking down at your pelvis. That pelvic floor is like a basket at the bottom of your pelvis. So if you can see me on the screen here, I have a pelvis here, and it's like inside at the very bottom, right between your legs, you have muscles that support your pelvic organs. And now that your bladder is sitting there, maybe you had your uterus removed, maybe you had your ovaries removed, maybe you still have your ovaries. So whatever type of hysterectomy you had, the pelvic floor muscles still need to really support your bladder and your rectum. And it can affect if those muscles are too tense, or they're not strong, or they don't have enough endurance there. That's really going to add to extra pain. It's going to add to bowel or bladder issues, painful sex, like a lot of different issues that people deal with when the root of the problem of the pelvic floor, if that's solved, we can actually change the way that you're feeling and functioning too. What's interesting is back pain and hip pain. If you go to a general PT and you're treated for those, if they don't assess your pelvic floor or really ask you screening questions to do with those muscles, that's where your symptoms can come right back, because the root of your core muscles, this is the bottom part, is your pelvic floor. And so those need to support your whole core system with your abdominals, your back muscles, and your hips and your whole pelvic girdle. So they're really important. And the fact that in physical therapy school, we hardly study this stuff, it's pretty crazy, because it's such an important part of walking and moving and sitting and everything too. So that's what your pelvic floor looks like. And it's important because any kind of surgery, whether a hysterectomy, a C-section, whatever type of pelvic procedure you've gone under, there is some trauma there, and trauma causes your muscles to tense up and subconsciously kind of tighten up. And so throughout this, I will talk about what that looks like, and pain comes from tense muscles. So if we solve that and we get those muscles to relax like any other muscle in your body, muscle group in your body, they have to be able to relax, but they also have to be able to be strong and contract when they're needed. And many women I see don't actually have to do Kegel exercises and contract and strengthen them, because in turn, those muscles are tense and they're guarding and they're holding subconsciously. And we have to learn how to let them go by training your brain to connect to them. And it's something you can't always do unless somebody points it out and guides you and lets you know, hey, maybe Kegels aren't the right fit. Maybe that isn't the right type of exercise for you, even though somebody told you to do Kegels. So that kind of goes along with my common myths. The first one is having to do with the Kegels. So Kegels, do you know what they are? That's usually described as cutting off the stream of urine. So you have to go to the bathroom and you squeeze and hold, and you're holding your pee. Those are your pelvic floor muscles that you're trying to contract and hold. That's a Kegel exercise. Now, I will hear over and over doctors say, do your Kegels when you're sitting at a stoplight. Do 100 a day. And many times that can make your pain worse. It can make symptoms of a prolapse or having healing from a surgery, all of that. It can make your symptoms worse. Even bladder urgency and bladder problems, because your muscles are tense and they're putting more pressure on the bladder, and we need to learn how to let them go. And then we gradually work on the strength if needed. But that's why having a baseline or working with someone that understands how that muscle system works is going to be so important too. So not everybody needs Kegels. My doctor said, here's another myth. My doctor said recovery would take about 6 weeks. Is that true? Not always. Everyone's going to be very different. I have seen women after hysterectomy, and it can sometimes take months. My job is to speed up that recovery and help the healing. And so they might not see me until later, but it can be as soon as 6 weeks for some women, and they start doing more activity, and it can be spread out a lot longer than that. So just know everybody is very different, and you can't put yourself in a category and say, okay, at this point I can start doing this exercise. You really need to listen to your body and see how you feel. Myth number 3, I just have to live with this bladder issue. I do see a lot of women dealing with bladder symptoms, maybe urgency, or they are coughing and sneezing and leaking, things like that, that can make the bladder problem feel like they're going to have to live with that the rest of their life. And that is absolutely false. There's a lot of strategies that we can teach on how to help your bladder actually function normally, and what is healthy, what's not healthy, and how to tweak and change that too. And then number 4, sex is out of the question. So if you're dealing with having any pain, or it's just a kind of a traumatic thing to think about after having a major procedure like this, just know you can actually have enjoyable sex again, and it can be very wonderful when we restore those muscles and get them feeling great again. So I'm going to talk about 4 tips to help yourself today, and things you can start implementing on your own. I really, for anyone that is on live right now, I would love to know like how far after a hysterectomy, because that kind of tailors how I talk through it too. So having a hysterectomy, that's when I did this the first time, I had somebody that was only 2 days post-op. So obviously that's going to look a lot different than somebody that might be, several weeks afterward too. I had somebody say feeling pressure on the lower abdomen. They're weak since their hysterectomy. So yes, being kind of nervous to overdo any sort of increased activity there. If you're having some abdominal pressure or some discomfort, yes, you don't want to overdo it. Somebody else is 4 months after. So thank you. It's helpful for me to know this because I can talk through that too. Yeah, and a timeline. All right, so 4 tips to help yourself today. First of all, it sounds very basic, but going back to some simple breathing exercises, I can't state this enough. So when we talk about diaphragmatic breathing, that's talking about your diaphragm moving up and down, which is that muscle right under your rib cage. And it has to move when you do some deep breaths. And anytime you're breathing, your diaphragm is a muscle. Well, that is the top part of what we call your core. So your core is made up of your diaphragm, your deep abdominal muscles, your back muscles that connect to your spine, and your pelvic floor at the bottom. And you can't just isolate one part of that core. It's really how the system works together. But after a surgery, after a pregnancy, after anything that you've gone through that's really affected that whole midsection of your body, you have to reset these muscles again and connect your brain to your muscles. So we call it neuromuscular training when we're working in rehab and trying to help people with their muscles to learn how to function again. So breathing is the most simple thing you can do because everybody does it, but are you actually doing it in a way that's therapeutic, that can allow your core muscles and your pelvic floor to learn how to activate again the right way? And it can relieve a lot of pain too. There's been research studies to show that when you're having pain, your muscles, especially around your core and your back, will shut off. And it takes that retraining again, getting your brain to connect to there again to get them to turn on and support your spine, support your pelvis, support your abdominal cavity, all of that together. So going back to some simple breathing exercises, I am going to actually share my video right now. So if you can see me, can you comment in the chat yes, that you can see me? And I will change my view here so you can see what I'm doing. Okay, I'm going to place one hand around my rib cage here, and I'm going to place one hand on my belly. Now, this is a great way to work on some breathing exercises when you're on your back with your knees bent. Just purpose of this video, I am not going to show in that situation, but I am going to show you sitting up because I think it's a better visual. But if you think of breathing in through the nose and out through the mouth, so I'm going to inhale and exhale. When you're exhaling, you're thinking of we call it pursed lip breathing, almost like you're just puckering your lips a little bit and exhaling out. The reason for your hand here on your ribs and the hand on your belly is you want to get some excursion through the rib cage. This can be sort of locked down through your upper back. And if you're in any pain, or even after pregnancy, we teach this a lot, is your thoracic spine or your rib cage gets a little locked down and stuck. So if your diaphragm is right here and all this is tense and stiff, then you can't get that diaphragm moving well. So we want the ribs to feel like they're breathing where they're coming in and out, like an umbrella opening and closing. So that's why one hand is here. So you're sensing when you take an inhale, can you get the rib cage moving out side to side? Because many times we breathe from up here in our chest. We actually want a third here, a third here, and a third here from your belly. So I take one hand here on the belly, one hand on the ribs. When I inhale, I'm going to feel my belly rise and fall, so into my hand, and I'm going to feel the ribs go in and out to the side. So does that actually happen? Can you train that and work on some breathing? And it slows things down, it allows those muscles to remember how to work again. And you're not tensing anything. All you're doing is some simple breathing. I have a great video of this on our YouTube channel at Level 4 PT and Wellness, our YouTube channel. And it's just labeled diaphragmatic breathing. So you can watch a video there on how to do some breathing exercises. That's number one, and you can start that as soon after surgery. And that will also help some of that tension and pressure in the abdominal area, because just getting the air down there into your pelvis and your lower belly is going to ease some tension and stress there. If you've had any scar, I'm going to admit one more person into this webinar. Thanks for joining us. I'm just talking through the first tip here. So I'm going to keep you on mute, and I'm recording this as well. So with the breathing exercises, if you're practicing that 10 to 15 times in different positions, maybe in lying down first so you can fully relax, that will be the number one thing that you can do soon after surgery. It could be as soon as a couple days after, or even when women come and see me, or we work virtually, we work on some breathing exercises first, because I want to see what's happening. And if you're locked down here and you can't feel that your rib cage goes out side to side, and you're getting a lot of tension up here, then we want to kind of reset that and get that working better too. So I'm going to go right into my next tip, although after this, then I'll go back and share my screen so you can see my slides. But the next tip is some simple exercises that you can start doing. These are on top of the diaphragmatic breathing exercises. This would be more about 4 weeks after surgery. Whatever the doctor has told you on limitations, you definitely want to abide by that. So they may tell you not to like do any heavy lifting, nothing over 5 or 10 pounds. They may tell you not to go up and down the stairs a lot, just anything that's going to be putting a little more strain and stress in the whole pelvic cavity area. So you want to rest. It's like just listen to your body. And if something doesn't feel right, it probably means that you're pushing yourself a little too much. So women will ask me, when can I start going for a walk? When can I start doing this exercise? Just kind of start within the household first. So if you are cleared by your doctor to start some activity and your incisions are healing well, wherever that might be, and you're not having any bleeding or some strange symptoms, then doing things within the house. And I'm not talking about vacuuming. I'm not talking about lifting kids or doing anything that's strenuous. I'm just talking about basic, general, like household chores of washing dishes, getting dressed, taking a shower, like the basic things. Once you feel like, okay, I've got a grasp on this, I'm not having any extra pressure or heaviness down there, anything out of the ordinary, then maybe you can try a walk outside, just nice, flat, level ground, nothing too hilly, nothing too strenuous. I do know at times when you have to lift like a child, you have to lift anything around the house. It's just really protecting the abdominal area and your pelvic floor a little bit first. And that could look like doing a little Kegel exercise or tensing your lower abdominals just a little bit in order to protect that area, because we don't want to do anything that's strenuous and bear down when we're doing that, because that can affect any kind of incision. It can affect just the healing and also just pressure down on your pelvic floor and through your abdominals. So that's where the breathing exercises come back into play. If you start getting any of that tension down there, go back to simple breathing exercises and just some light walking. Your body needs the blood flow and circulation, but when the pressure or heaviness is down there, just dial it back a little bit. And then maybe the next day you add just a little bit more and a little bit more. So it's going to be very gradual. One exercise that I say about 4 to 6 weeks afterward, I'm going to show is called the puppy pose. So if you use your kitchen countertop, I actually have my treatment table here. So I'm going to raise that up. So pretend like if this is your kitchen counter, you're going to hold on to it. And I'm just bending forward, kind of stretching forward. And my hips, you can see like my hips are going back. And I may just do some light breathing here, and I'm going to get my belly button going down toward the floor. So in doing that, I'm kind of opening up the pelvis a little bit and just real gentle. I'm starting to work on the positions of my pelvis so I can stretch through the upper hamstring and the pelvic floor muscles a little bit too. If that does not feel comfortable, then going on your back and just doing some gentle exercises with your knees kind of falling out and stretching the inner thighs and some of the muscles through your hips that way, just in a very supportive way, might be better. So you can try one of those. The other thing, do you want to drop belly in that? I'm just answering your question. Belly in the stretch and breathe into belly. Yes. And that will allow your pelvis to be in a different position. Many people, when they spend a lot of time sitting, this reverses it. So it gets your pelvis kind of going into a more of a forward tilt. And in doing so, that's going to stretch through your pelvic floor muscles a little bit. So like I said, you want to be cleared by your doctor before you do that one. I would just go back to walking and some breathing exercises, and even child's pose position. So like a yoga stretch, a yoga pose is helpful too. When you are past that like 6 to 8 week mark of starting to do a little more activity and you start doing more walking, you're feeling a little more comfortable, then working on some hip exercises and some upper back rotation exercises are going to be a great thing to do. I'm going to show one rotation stretch. So this like I mentioned, be like about 6 to 8 weeks after, or whenever you get cleared by your doctor. But you want to be on your side, your hands are together. You can put a pillow between your knees, and you're going to raise the top arm, and you're going to do a little rotation stretch. So I'm going back and forth like this, just opening the chest, lifting the top arm, and rotating backward. So you're getting a little pulling and stretching through your upper back and maybe through your abdominals a little bit. You want to go to a range of motion that feels comfortable. No increased pressure or tension, just more like some good stretching through your upper back. Because your upper back will get tense and stiff, I always like to go kind of above and below. So hip stretching and upper back rotational type stretching is good for the whole pelvic and abdominal cavity too, and to help with any back pain that you might be getting. Okay, I'm going to share my screen again, and we're going to go back to my slides. Okay. You talk through diaphragmatic breathing and stretches that relax your pelvic floor. Another video I have on our YouTube channel, Level 4 PT and Wellness, you can type in pelvic floor relaxation. So I put, I think, 2 exercises on there too. Like I said, that's more when you're cleared by your doctor too, that you don't have anything that's going to be affecting any stitches. Scar tissue mobility. This is not something your doctor will teach you how to do, but you want to, once the scar, some women will have an abdominal scar, some will have little, if it's more like the portal sites on their lower abdominal area. If you have any scar tissue anywhere after about 2 to 3 weeks, when you've been cleared, there's no infection, it's fully closed, and you can do some massage around those areas. So I like to advise the women that I see, if you are taking 2 fingers and you're going to go in a like circular pattern around on the scar and slightly above, slightly below. Sorry, I'm getting notice here on my thing. Okay, slightly above and below, but doing some circular patterns and some up and down on that scar. What's important is the muscles underneath there will not fully be able to get their strength back and get nice and strong if you have any scar tissue there. So it doesn't matter how long it's been since your surgery. If you go to see a professional that is teaching you how to do scar tissue work, you can improve it at any stage. I mean, I've seen women that have had C-section 10 years ago. We can still help the scar tissue there if you're doing the right types of massage for it. So more of a circular pattern or up and down. It's gentle, but it's enough that you're going to feel maybe on one side or the other that's going to be a little more restricted. Sometimes that can lead to any abdominal discomfort or having pain in the lower abdomen too. Okay, so you can let me know if you have any questions about that. Then one of the most important things is sitting posture. So I catch a lot of people when they're sitting back on their tailbone. Well, what this does, it tenses up the pelvic floor muscles. And like we talked about, when those muscles are tense, they're not able to support your bladder and your rectum, and also can create extra tension and pain. So when you're sitting, the important thing to do is find a position where, like if you're in the car or you're sitting at a desk or you're on the couch, it's a little bit harder to do on the couch because you're going to sink in, but you want to find a position where you can get right over your sits bones and not kind of sit back on your tailbone. If this is uncomfortable soon after surgery, obviously you're going to go to a point of maybe sitting on a cushion or something that's a little more comfortable to ease your symptoms. But I'm talking about after 6 to 8 weeks, if we get more comfortable sitting up on your sits bones and right over the top of your pelvis, then you're going to stack your spine up in a more neutral position. You're going to have less tension in your pelvic floor. Things are going to heal a little bit better, and you'll actually feel like you need to use your core. So you're using your muscles a little bit better and more supportive. I have many people I teach that you want to take like a little bath towel, you roll it up, a hand towel or bath towel, and put it right in the small of your back if you're in your car, because that's a good way to make sure that you're right over your pelvis, and then you're not sitting back on your tailbone. So I find that one is often missed, and it's really important for healing and pelvic floor strength and core strength over time too. So keep an eye on that. Okay, I want to answer any questions. So if there is anything specific, please ask in the chat. Is anything that I talked about, something that you've tried already, or maybe you're dealing with? It's always good to know there too, because I have helped so many women after a hysterectomy. Different things can come up, and it's always great to talk to maybe somebody else, but not necessarily comparing your story, because every healing situation is going to be very different. Every surgery is going to be a little bit different. Some women that have had a total hysterectomy versus a partial, they're going to go through different things too. So it's good to get support from somebody else that has seen it before, but not necessarily comparing your story with other people, because it can be frustrating if you're dealing with some symptoms and maybe somebody else is like, oh, I got through it just fine. But I find more often women are, even if they're feeling like they're healing well, there's certain things that we can kind of speed up that process for them and make it more smooth too. So if you are someone who maybe have been dealing with a painful issue or just want guidance through here, the problem, if it's been going on for a few months, it's not going to heal itself on its own, and it can actually get worse. And that's one thing that I want to point out, because you shouldn't have to live this way, and you should want to, get more active and just feel like you can get back to feeling like yourself again. It can affect your relationship too, if it has to do with having any pain or uncomfortable or not feeling like you ever want to have intercourse. So worried about how it might be affecting your relationship. And if it's definitely over 8 weeks and you're concerned or feeling scared or nervous, or maybe you brought some of this stuff up to your doctor of what your symptoms were and they kind of brushed it off or said, just take longer, you'll take a while to heal, or you didn't get the right answers, or they put you on a medication, that is definitely something where you want to consult with someone that knows what they're talking about and can be a resource for you. So working with a pelvic floor specialist, what does that mean? If you have ever heard of it before, it does not hurt. That's a myth. We're very gentle, and it's not as invasive as going to the gynecologist. And many times there's things that we don't necessarily have to do internally to teach you, but guiding you with your symptoms and your history, it can be pretty amazing, the breakthroughs that women have that we see that are like, I wish I would have done this sooner. Not to be embarrassed at all. I promise we have seen it all. That's why we're trained in this. And the fact that you can go to any PT for this, that's totally false, because there's only a select, just like a select few really around different cities of who's a real pelvic floor specialist and trained well to do it. So and we talked about the Kegels. That is definitely a myth. Is there a question I haven't answered? I would love to be able to answer that. I realized this is not on my webinar Zoom, so I may run out of a little bit of time, but the best words that I want you to describe yourself after this is feeling more confident, feeling healthy and happy, and empowered. It's like we're a resource for you, a guide, not to depend on us, but we're here to coach you and guide you. And so if you're someone that is struggling with one of these issues and worry it's only going to get worse, you can definitely speak to me on the phone. I will do an individual phone consultation. And I do have a special virtual program that has rolled out for anyone healing from a hysterectomy that maybe is not local, or they want to just have the comfort of their own home to work on some of the things that I would teach you. So I only have room for 3 more people because I did open this up last week, and it will be some one-on-one sessions with me of doing virtual as well. So if you want to sign up for that, I am gonna put in the chat our website to be able to book a phone call. And then that way you can find out more what it takes to work with me in person or even virtually, which is a popular way to do it. And we can actually get a lot accomplished that way too. So it is possible to feel great in your body again, heal your relationship if that's something you're struggling with because of some pain and feeling like this is really a hard thing to go through. Healing your pelvic floor and improving your confidence. I really am passionate about helping people this way too. So just want you to know there's help. Is numbness common months later? It can be, yes. I have actually seen that quite a bit when those nerves that innervate the skin and go to the skin there can actually take a while to regenerate. So it depends where the numbness is, but that's something I'd love to talk you through there too. So please let me know how I can help. I hope this was helpful. Just gave you little tidbits of what we do as pelvic floor PT, but also to somebody that understands your type of surgery and can guide you in the right direction. That's what I'm here for. So thanks again, and I will send a replay of this as well. Have a good night.